I'm Holly Cohen, licensed independent broker and founder of MedigapCares.org, where you can book a free Medicare review with either me or an experienced member of my team. So today I'm going to be guiding you through the various aspects of Medicare, including Original Medicare and Medigap and Medicare Advantage. Let's start with what I like to call a T-Chart exercise. So please take out a notepad and pen, you can stop the video, and draw a straight line from top to bottom, and then draw one line across, creating 4 equal boxes. In the upper left-hand box, please write in letter A for the Part A of Medicare. In the upper right box, please write the letter B for the Part B of Medicare. In the lower left-hand box, please write the letter C, and then in the lower right-hand box, please write in the letter G. So let's start up in the upper left-hand corner with Part A of Medicare, also known as Original Medicare, both A and B. Part A covers inpatient services such as hospital stays, hospice, and skilled nursing or rehab. It provides coverage for medically necessary treatments when you stay overnight, hence the term inpatient. Write Original Medicare in that A box on your chart because this is part only of Original Medicare. Now, let's head over to Part B. Part B is also Original Medicare. So you can write that in at the top of the Part B section. Part B covers outpatient care and a wide range of outpatient medical services, including visits to your doctor and specialists, tests like MRIs, CT scans, lab work, blood work, outpatient surgeries, also outpatient treatments like infusions or injections that you may have at the doctor's office. Part A you automatically got just simply by working 10 years and paying into Medicare and Social Security for all the years that you've worked. The government only wants to see 40 credits, which equals 10 years of work history and paying into the Social Security and Medicare system. Part B has a monthly premium. Most Americans will pay $164.90 this year in 2023. If your income is in a higher bracket, you may be paying more for that Part B premium. So next, let's talk about Medigap plans. Medigap plans help fill in the gaps, hence the name, in Original Medicare coverage. All Plan Gs are standardized by the federal government, created back in 1965, ensuring consistent benefits across the different insurance companies that put out the Medigap plans. Most Medigap plans pay the 20% after Medicare pays the first 80%. And most Medigap plans pay the deductibles that are in Part A. The most popular Medigap plan and the most comprehensive Medigap plan at this time is Plan G. Let's head down to the lower right-hand corner and let's talk about Plan G. Plan G is the Medigap plan that pays the 20% of your Part A, and it pays any deductibles in Part A. So you have 100% coverage from day one in the hospital if you're on a Medigap Plan G. Medigap Plan G also pays the 20% after Original Medicare pays the first 80% in all Part B services. The only thing that a Plan G does not pay for is the Part B deductible, both the Part B premium and the Part B deductible, most likely will change for 2024. So stay tuned to future videos. Once that information is released, I will definitely share it with everyone. So what I've described so far, Part A and Part B, and a Medigap Plan G, is original Medicare with a Medigap plan. It allows you the freedom and the flexibility to go any doctor, any hospital throughout the whole United States that accepts your red, white, and blue card, your Medicare card. And it pays that 20% left over after Medicare pays the first 80%. It pays all deductibles in Part A, and the only thing that you are responsible for is paying your monthly premium to Medicare for Part B, paying your Medigap premium, and then also the $226 one-time per year deductible of Part B of Medicare. Every Plan G is the same. They are standardized and federalized by Medicare, by the federal government. And what that means is it could be with any insurance company that offers Plan G in your zip code. You are allowed to enroll in. You're allowed to enroll during annual enrollment period, which is October 15th through December 7th. If you are currently on a Medicare Advantage plan, in that time frame that's coming up, October 15th through December 7th, you are allowed to come off of a Medicare Advantage plan and go back over to original Medicare Part A and Part B, and you're allowed to apply and enroll in a Medigap Plan G. Now, here's the rule. If you have had Medicare Part B for more than 6 months and you're over 65 years old, you will have to go through medical underwriting questions and be either approved or denied Plan G by the Medigap insurance company. Every Medigap Plan G is the same. Your Medigap Plan G card could be with McDonald's insurance. I like to make that joke because it drives the point home. Literally, it doesn't matter the insurance company name printed on your Medigap Plan G secondary card, because when you go to your doctor's office or a hospital, the doctors and hospitals, when you're on a Medigap Plan G, are billing original Medicare. They're billing our Medicare fund, our federal money we pay into for Medicare. They're billing that fund when you are on original Medicare. And again, if your doctor has ordered it and deemed it as medically necessary for you, Medicare must pay any medical treatments at 80%. They bill Medicare, and then Medicare pays back your doctors and hospitals 80% of the bill, and then Medicare goes on to bill the insurance carrier. So if it was McDonald's insurance, Medicare would be billing that 20% to McDonald's. Now we're also going to discuss one more letter on the lower right side. Please write in letter N. Medigap Plan N also pays the 20% after original Medicare pays the first 80%. It also pays all deductibles in Part A. Now, Plan N, how it relates to the Part B, the outpatient side of Medicare, is on Plan N, you are still responsible for the Part B outpatient Part B deductible, which this year equals $226. And again, Medicare will pay that 80% and your Plan N will fill in the 20%. Here's the thing. Plan N monthly premiums are less than a Plan G monthly premium. Usually, in most states, roughly between $30 to $50 a month difference between a Plan N and a Plan G. Again, state by state. So every state, and even within every state, within your zip code, there are different prices for these Medigap plans among the different insurance companies. Plan N has a possible $20 copay when you visit the doctor. It could be less because actually a doctor is allowed to charge up to $20, so it could be less. A Plan N in most states, not all, but most states, you are subject to what's called the Part B excess charges, which simply means that if your doctor or the outpatient facility, anything under Part B, wants to charge the patient more than what Medicare pays them for that service, it's called an excess fee. They are allowed to pass on 15% of that excess fee to the patient. Now let's talk about Medicare Advantage, also known as Part C. So head over to the letter C on the lower left-hand section of your T-chart. A Part C, also called Medicare Advantage, is a private insurance company taking over your original Medicare. Literally, you give up original Medicare. And if you're on Medicare Advantage, that Medicare Advantage plan replaces your original Medicare Part A and Part B. What I mean by that is everything I just explained about original Medicare and a Medigap plan, original Medicare Part A and Part B, you can literally cross that out because if we're talking about Medicare Advantage replaces it. You no longer have access to original Medicare. You no longer have access to our federal Medicare fund. The government actually pays money to the private insurance company that runs the Medicare Advantage plan on your behalf to take over your health care, meaning that there are networks that you must stay in, a PPO or an HMO network. An HMO is going to be more confining than a PPO because an HMO Medicare Advantage plan requires you to stay inside the network and you cannot leave it or you will not have any of your medical bills paid for. And HMOs require a referral to see specialists. If you're on a Medicare Advantage PPO plan, you are allowed to go outside of the network. However, going outside of the network also means a higher max out of pocket. So Medicare Advantage plans, you can also write in the lower left corner, have max out of pocket amounts that run in the thousands. In fact, this year, the government has capped the maximum out-of-pocket cost at $8,300. And once you're on a Medicare Advantage plan, you are allowed to make a change. October 15th through December 7th of every year, you can switch from one Medicare Advantage plan to a different Medicare Advantage plan in that time frame. Or, as I said earlier, you can switch from Medicare Advantage to original Medicare in that time frame, and you can enroll in a Medigap plan in that time frame, and everything would start January 1st of next year. So thank you for joining me today as I've explained original Medicare versus Medicare Advantage and how there are two distinct ways to have your Medicare set up. One being on the federal original Medicare program, our red, white, and blue card that you get when you turn 65 or go on early for disability and pays 80%, and then you get a Medigap plan that fills in the gaps and pays the balance, the 20% of the bill, and you're only responsible on Plan G for that $226 annual deductible. And then, of course, Plan N we've discussed. Medicare Advantage is a completely different world. It's a completely different way to be on Medicare. Some people love it. In fact, 51% of our population are on Medicare Advantage plans currently. But it really varies. It's a choice that you have to make. Whether you want to keep original Medicare and know that if you did switch to Medicare Advantage, you may be giving it up forever. To get back to a Medigap plan, you do have to go through the medical underwriting questions, again, if you've had Part B for more than 6 months. There's also a Plan F that I did not go over. It's for anyone born prior to 1955. If you've had Medicare Part A prior to 2020, then you are eligible for a Plan F. If you're born after 1955 and you started Medicare after 2020, you are eligible for Plan G and Plan N. You're not eligible for Plan F, but if you're older and you are eligible for Plan F, those folks are also eligible for G and N. Some decided to stay with F. You definitely don't have to. Plan F has been grandfathered, and the only difference between a Plan F and a Plan G is that a Plan F pays everything that Medicare doesn't pay, meaning it pays the 20% of both Part A and Part B. It pays all deductibles in Part A and Part B. So that is the biggest difference, is that a Plan F pays everything, but only those born prior to 1955 and or started Medicare prior to 2020 are eligible for a Plan F. Plan G is the most popular Medigap plan, and I know it's a big decision trying to figure out which way is better for you, especially if you're on a Medigap plan and the premiums have gone up, and maybe you're considering a Medicare Advantage plan because they usually have a $0 monthly premium. But just please remember, a Medicare Advantage plan takes you off of original Medicare and puts you in a network plan where there are many times prior authorizations for most treatments and a high max out-of-pocket cost, and doctors and hospitals switch networks even midway through the year on Medicare Advantage plans. So just know all these things if you're weighing that decision. That's all for today. Thank you for joining me on the Medigap Show. If you like the video, please hit the like button and subscribe to the channel. I promise to keep you posted on all things Medicare as we head into our annual enrollment period. Feel free to reach out to us at medigapcares.org. You can schedule an appointment there for free. Everything's always free to you, all of our services. Also, you can call us at 855-265-6334. We're happy to answer all your questions and make sure you understand everything there is to know about Medicare. That's all for now, and as always, be well.